The most important thing in cancer surgery is to remove all cancerous tissues. To this end, extensive range of tissues, including cancers and normal tissues, are removed and pathological diagnosis on marginal area is conducted to confirm whether cancerous tissue remains. This diagnosis is based on a frozen section biopsy, which requires tissue freezing, slicing, staining, and slide making, which takes at least 20 to 30 minutes, and in some cases up to an hour. This time is by no means short.
Brain tumor surgery, frozen biopsy is essential to identify the exact morphologic features of the brain tumor before maximal surgical resection. This labor-intensive process is not favorable because it takes 40 minutes, and it means that the surgeon must wait patiently.
For example, during a breast cancer surgery, more than half of the total surgery time is waiting for frozen biopsy results. Also, this extends the duration of anesthesia, which slows patient recovery and increases the risk of complications. Because of its slowness, surgeons request minimum number of frozen biopsy and are unable to utilize sufficient pathological diagnostic confirmations, which exposes them to sampling errors and risk of recurrence. Unfortunately, this issue has been overlooked and has maintained for over 100 years due to the lack of innovation in technology.
My name is Kyungmin Hwang, and I'm CEO of VPIX Medical. VPIX Medical is a healthcare startup which develops a real-time biopsy platform for assisting instant surgical decision. Our goal is to develop an innovative intraoperative digital biopsy platform that allows surgeons to check the clean margins of cancer in real time through in situ microscopic images device, instead of wasting time in the operating room waiting for the biopsy result. cCeLL, developed with VPIX technology, is an ultra-compact handheld microscope that can acquire high-resolution digital images of 400 magnification in real time. The biggest benefit of this product is that it can generate a digital images without cutting or processing the tissue. Using a conventional approaches, it's necessary to make a tissue slide, which takes at least 30 minutes and sometimes several hours of preparation. However, cCeLL allows microscopic images to be generated immediately, and digital microscopic image can be acquired by simply contacting the suspect area with a proof after applying a frozen dye harmless to human body. With cCeLL, surgeon can explore distal pathology with unlimited images of tissue in situ. And since it's distal, cCeLL images can be transferred to the pathologist regardless of where they are and get their analysis instantly. Since cCeLL enables quick imaging without a complicated preparation process, all suspicion area can be easily analyzed, and it is expected to be particularly useful in surgeries for breast cancer, skin cancer, and prostate cancer because they usually require frequent margin analysis. Moreover, cCeLL can also obtain images non-invasively by simply contacting the patient's organs without biopsy. These in vivo approaches will be able to provide information that was unavailable so far on organs with high biopsy risk, such as brain. In the future, cCeLL will expand its use case to minimal invasive surgeries such as endoscopic and robotic surgeries, and also screening for biopsy sampling. Histopathology has the potential to contribute to various fields, but has been limited in very small number of applications due to its constraints. We believe that cCeLL will redefine histopathology by bringing histo transformation to it, and will make a real difference in the way healthcare is taking place, and most importantly, will save lives of millions of people like just you and me.